Mark and Brian back again. We're going to show you the second in this series of exercises after you've had a total hip replacement. So, one thing that you lose when you've had a surgery like that is you lose your joint awareness, okay? And so you want to work on that. And the second thing is you want to train the muscles to fire involuntarily also. Voluntary would mean when you're doing an exercise and you're consciously making them contract. So like if you're doing a leg extension or a squat, but you're consciously making those muscles contract. But in function, in real life, those muscles also have to be able to turn on without you thinking about them, because that helps provide stability. So a great exercise for that to start returning that quad muscle strength for you, and again, a very safe exercise for you to do post-surgery, is what we call a retro step, so stepping backwards. So we're going to say Brian's left leg is his surgical leg again, so he's going to step forward with his right. Your other right, this one. Oh. All right, so you're going to be in that position here. Now what you're going to do is you're going to be up on your tiptoe on your back, on your surgical leg here. And then what you're going to do, slight bend in your knee. You keep that slight bend in your knee. You rock back, pull your toes up on the front leg. So you're rocking back, and that's going to cause this quad muscle, the thigh muscle, to fire because you're putting weight onto it. So you rock forward, your heel comes up on the left leg, so the surgical leg. Then you rock back, pulling your heel up or your foot up on the front leg. So this is working the left leg. So the left leg is going to be back. That's our working leg. So you're rocking back and forth. You'll feel that tension going to that muscle. Again, you're not losing any of your precautions with this exercise, so it's very safe. But it's a way to start focusing on turning those muscles on. Now, if you're in a walker still, you can do that supporting yourself in a walker. Or if you are stabilize yourself holding on to the back of a chair or a wall. But you always want to be safe, so better to be conservative and make sure you're stabilized. Okay, you're on the wrong side.
I know, wouldn't it be good to switch too?
Sure, and you can switch if you want to do the other side too. But you're going to focus on that back leg, okay? So, second exercise, very good one. 10 reps. Spread out throughout the day, every hour or two, even if you can, but based on your tolerance. And that's very important. You're not trying to work through pain or increase your pain. So listen to your body also when you do these things. If you have further questions, or did you have a question, sir?
If maybe your balance isn't so good directly after surgery, have something by you to hang on, for safety. If your balance isn't good, if your muscles aren't working, you might lose your balance. So have something by you just in case, a counter, back of a sofa, just to have there for stability, support if you need it. If you have further questions, contact us at fitness4lifept.com.